Hi there, it's Dr. Scott McLean, and this is a YouTube video about implant dentistry. During this video, we'll actually be comparing an analog model with a digital model to fabricate this beautiful bridge. We're actually going to make it on the analog model, and then go back and verify things because we're going to be doing a test. And the test will be to compare these new PoLo scan bodies, which have just come out in 2025. And we want to compare these to show that they are indeed accurate and do what they're supposed to do. So our goal will be to capture both an analog model and also a digital model, fabricate the bridge, and then come back and take that bridge and put it on the printed model and check to make sure this is verified so that we have a passive fitting structure. Because the new bridges, they actually fit right down on top of the multi-unit abutments. So anyway, let's get started. We're going to pretend that the patient is actually the master cast, and I'll show you what I'm going to do to compare these two processes to get a nice impression. We'll begin by pretending that this model is the patient, and we're going to do a pickup impression using analog impression material. We'll be using polyether here. So we start by putting on the multi-unit impression copings with long pins. You can see this long pin that's right here. It's going to sit down on that multi-unit, and so this is the best way to pick it up. So the multi-unit is sitting on the implant, then we pick this up. So we have these nice long pins so that they will poke through the impression tray. So yes, this is analog, and we're going to be talking digital in a second, so you just have to hold on for a minute. So we'll put on the impression coping, and it fits down, it's non-engaging, and we're going to actually be using stabilizing wire to secure these impression copings. And so we'll tighten it down with a Unigrip driver from Nobel. And you can see here that I'll put the wings to the facial, and so by doing so I can take some composite or composite depending on where you're from and put this on the wing so I can take the stabilizing wire and secure the two pieces together, because we want this impression to be passive fitting. Passive fitting means you're not going to be torquing the implants, you're not going to be breaking screws, you're not going to be having a problem with fracturing implants, and there's a whole bunch of things that come with passivity. And so we've always wanted to have passive screw retained bridge work. So here I've got the two posterior wires on, which is I like to do first. I'll come back and do the anterior stabilizing wire. I get these from Patterson Dental and cut them into 5 pieces when I get them. They're nice firm wire, and it's actually making a very rigid structure that's going to be picked up inside of the impression. So the impression material is going to be all around this. So it's going to stabilize where these implants are. So when we did the impression in the patient's mouth, we had all this in the patient's mouth, and we took the polyether and just did an impression with open tray impression. So we used a custom tray and had the long pin sticking through and took this off, and then we were able to pour up the master cast. We also did a multi-unit PoLo scan, and this scan was created using this 2-piece system. So you have an up and down part and a lateral part, and you put them together depending on what you need to do the job. And sometimes you just use the up and down part and not the other. But they are scan bodies, and so when we take them, we're going to put them together and screw them in. And once they are like this, you can take them and screw them onto the multi-units. Now you might ask, why do you have to have this lateral part to the scan body on the PoLo? And scan bodies typically like this are done so that you're picking up the space in between the implants, because this is the hard thing when you're taking multiple of thousands of images and stitching together. Then the images need to be stitched on top of some type of hard structure rather than soft tissue, because it confuses the scanner. So by doing it like this, you actually have hard structures that the scanner can pick up, and has a three-dimensional image to it. So this is what's going to be important, to have the passive fit. The interesting part of this little mini experiment is that we're going to be able to put this on with the OmniGrip mini screwdriver, tighten them down, and then start to do the scan, as you can see here. And you want to do a very quick scan, back, forth, around one side, around the other, and not do too many multiple scans, because more is not necessarily better on this particular way of doing it, because you get too many layers and thousands of pictures. So let's continue on and now verify the models. When we're doing something intraorally, we would take a structure that's made very similar to what you're seeing here, take it to the mouth, secure it with one screw on the end, and do the Sheffield test. You want to put it on and then make sure that it's passive fitting. So if you put one screw on one side, and usually I'm using a screw and not the pin, I just want you to see it. But when you put one screw on one side, the opposite side should be very passive fitting. You can take an x-ray and verify that. Difficult to do on the new digital stuff. So what I'm doing is feeling it as well, so there's a tactile sense to when you push up and down on the model. So what we can see is this is passive fitting on the original model. And so looking back at the new bridge, we can see how gorgeous this Zirconia bridge is. There's no metal in the abutment that's in the bridge, so there's no cemented abutments. So this is really important for us to understand, because the zirconia is actually sitting down directly on the multi-unit, which enables you to do an angled screw channel. And the angled screw channel is going to allow you to put the screw channel where you want, because you don't always get where you want to go with this. And so there's different options. We can put a 17 degree abutment on, or put a 30 degree abutment on, but we can also angle the screw channel and get it to be ideal where we want it to go. So looking at this model, this is now a master model that's been verified, and now we know that this is verified because I did the Sheffield test. We can take this and go to the Nobel Biocare Center in Malwa, and you can see here I took a video of this doing the actual verification of the model to the prosthesis. And I believe that Nobel is the only one that does this. I'm not 100% sure, but I was told that they do this Zeiss accuracy test and enabling it to make sure that it fits, because when they're fabricating these, there's a shrinkage that occurs, and so you do have to make sure that this is fitting passively so that there's no undue non-passive fit, because the multi-units now are going to be made a little bit different. You can see this is the new style, and I can't wait to get my hands on those. I don't have those yet. So when we put this on the master cast, we can see it's passive fitting because of the way this 40-degree angle on top of the implant abutment is. So looking at this, we can see that there's passive fit. We can actually visually see it because it's been made on this, and so it should be passive fitting to the model. But what happens when we take this and then put it on the new printed model, especially when you don't have the metal component? So we want to see this. So these new PoLos can be adapted using DTX Studio, 3Shape, or Exocad, and so they can design what you need to do. So as you do this, you scan the PoLos and you get the pickup, and then you come back and do this scanning pattern very quickly. Don't be spending a lot of time to make it look perfect. We don't want layering of the images. So then you scan reverse, and then you take those scans and you put them together with some other scans of the actual white caps themselves, so that you can pick up the soft tissues, and then you can send this off to one of these three programs, and then they can fabricate this beautiful bridge for you. And you can see here's on the printed model, it fits perfectly. So it's got passive fit according to visualization, and we want this to be passive. This is really critical. So I was quite delighted when I saw this, because my patient comes about 5 hours and I didn't want them to have a problem, and so I verified this, and we've done a number of them now, so you can see that the fit is just beautiful on this, and so I was quite excited. So taking it by my hand, I'm taking the bridge and actually feeling, because the bridge you can feel more than on a PMMA bridge, because on a PMMA there might be some flexing. Here there's a very rigid, it's 1400 megapascal bridge, So it's a very gorgeous structure, and so I'm quite excited to be going down this path with the digital workflow with the PoLo, and actually we're going to try some of the other ways with photogrammetry too, see how that works, and try to spend some time doing it all the different ways, because there's some really great advantages to doing it with fast mapping or with iMetric. And so all these things you need to investigate before you get into one or the other and find out what's best for you. And certainly this is a good option, but I think that we need to look at all the options. And so looking at this, we can see that the fit is quite nice on the printed model, and I can visually see it, and because that's my challenge, is to make sure that this is passive fitting. So this is a nice beautiful bridge on that printed model, and we can see that it's making my life easier, and that's what we want, is to make things so that they're going to work better and be passive fitting and work for a long time, because we want this to be screwed down and then have the patient have good quality of life. We want excellent quality of life, actually, and to make this so that the patient is really going to enjoy themselves with these teeth, and make it so that we get to the digital workflow to be actually all fully digital. And so this is the key to aesthetic long-term dentistry. These are gorgeous in the class of their own. And looking at the the model and the printed model with the bridge that was fabricated on an analog verified model, you see how beautiful this fit is. And just think about it. This is really incredible, and I'm quite excited to be learning about this and sharing it with you. So enjoy the video. As we put this on and off of the multi-units, we can see that this is a beautiful structure. So this is Dr. Scott McLean, and this has been a YouTube presentation about the PoLo scan body and also about the Zirconia Bridge. So I hope you get a chance to try the NobelProcera implant bridge for the all-on-4. It's a really great option for your patient, so check it out. So again, this is Dr. Scott McLean. Thanks for stopping by, and hope you can hit the like button and give me some more likes and send this off to any friends.